everybody. Hi everyone, my name is Anna Parkinson. This is a short presentation on safe sex STIs and the HPV vaccine. Alright, let's talk about sex. Here are some things to discuss with your patients. Of course, the only way to protect yourself from STIs is to abstain from all sexual acts. This means no touchy-touchy. By using barrier devices such as both male and female condoms, dental dams, and sponges can greatly reduce the risk of contracting or spreading an STI. These must be used on every sexual encounter. Discuss with your patients the importance of talking with their sexual partners about STIs. These are just a few examples of rates of prevalence. There we go. This is just a few examples of rates of prevalence of STIs in the U.S. With all of these, we see a significant increase from 2014 to 2018. Anyone having sex is at risk for STIs. However, there are certain groups of people who are at higher risk. Alright, there are so many to choose from. Chlamydia is a common sexual transmitted disease that can be easily cured. If left untreated, however, chlamydia can make it difficult for women to get pregnant. Can be asymptomatic or may have discharge, dysuria, urinary frequency and urgency, and pelvic pain. A nucleic acid amplification test, or NAAT, can confirm diagnosis. Treatment can differ slightly depending on the strain, but typically involves azithromycin and doxycycline, or azithromycin and ceftriaxone. Gonorrhea is a bacterial STI. Gonorrhea can cause very serious complications when left untreated, but can be cured with the right medication. Common complaints include dysuria, yellow, white, or mucoid urethral discharge in males, greenish irritating vaginal discharge in females, menstrual irregularities, pelvic pain, and fever. The NAAT test is also appropriate for diagnosis for this disease. Treatment varies as if it's the first episode or a recurrent episode. Acyclovir and famciclovir is the primary episode treatment. Human papillomavirus is the most common sexually transmitted disease in the U.S. Common complaints include painless genital lesions, pruritus, bleeding during or after coitus, malodorous vaginal discharge, and dysuria. Visual confirmation and a pap smear are satisfactory for diagnosis. Unfortunately, there is no cure for HPV. Advise patients to abstain from sex if warts are present. Podophylox solution or gel applied twice daily, 3 times a week for weeks. Surgical excision, cryotherapy, and laser therapy are a few options for treatment of external warts. There's trichomoniasis, cancroids, scabies, and many more. Alright, now we hit on our most common STI and the vaccine that can change the trends. The HPV vaccine is available for both boy and girl adolescent and young adults who have not been exposed through age 26. The first dose is typically from 11 to 12 years. Dose number 2 is 6 to 12 months following that. HPV can result in cancer, so this vaccine not only prevents an individual from HPV itself, it also prevents from precancers and cancer-causing infections. For those who do not have insurance, there are ways to receive the vaccine at no cost. Education. Educate your patients on where they can be tested. State health departments are great for those without insurance. You can also get tested at primary care offices and urgent care offices. Educate your patients on condom use and practicing safe sex always. If a patient tests positive, they must understand the importance of notifying all sexual partners within the last 60 days. While taking medications for any STI, patients must abstain from sex. Go see a movie. Emphasize prevention and behavioral changes to reduce the risk of contracting or spreading an STI. Primary prevention can include HBV and HPV vaccines. Secondary prevention Measures such as cervical cancer screenings and STI screening for at-risk patients. Patients with chronic viral STIs, we must provide patients with education, counseling, and compassionate care. Do not alienate your patients. Thank you very much. I hope you enjoyed my presentation.